Assalamu alaikum guys. Today in this video we are talking about another scenario. A 37-year-old man visit his physician because he has noticed the clumsiness of his right arm. The symptoms started at the 6 months previously and are getting worsened. He also noticed that his right hand has a tremor when he attempts fine movements or tries to insert a key in a lock. When he walks, he noticed that now and again he tends to reel over to right as if he had too much alcohol to drink. On examination, the face is tilted slightly to left and the right shoulder is held lower than left. Passive movement of arms and legs reveal hypotonia and looseness on the right side. When asked to walk heel to toe along a straight line on floor, the patient sways over to the right side. When he was asked to touch his nose with his right index finger, the right hand displays tremor and the finger tends to overshoot the target. Speech is normal and nystagmus is not present. Using your knowledge of neuroanatomy, explain each sign and symptom in the lane of cerebellum and likely to be in the midline or to one side. The man at operation was found to have an astrocytoma of the right cerebellar hemisphere. This fact explains the occurrence of the unilateral symptoms and signs. The lesion was on the right side and the clumsiness, tremor, muscle incoordination and the hypotonia occurred on the right side of the body. The progressive worsening of the clinical condition could be explained on the basis that more and more of the cerebellum was becoming destroyed as the tumor rapidly expanded. The flaccidity of the muscles of the right arm and the leg was due to the hypotonia, that is, a removal of the influence of the cerebellum on the simple stretch reflex involving the muscle spindle and the tendon organ. The clumsiness, tremor, and the overshooting on the finger nose test were caused by the lack of the influence on the process of the coordination between different groups of the muscle and the falling to the right side. The tilting of the head and the dropping of the right shoulder were due to the losing of the muscle tone and fatigue. During a ward round, a third-year student is asked to explain the phenomena of nystagmus. How would you have the answer that question? Why do the patient with cerebral disease exhibit the nystagmus? Nystagmus is an involuntary oscillation of the eyeball. May occur physiologically as when a person watches rapidly moving object or by the rapid rotation of the body. It commonly occurs in disease of the nervous system, eye, and inner ear. Nystagmus is due to the ataxia of the muscle moving the eyeball. There is a lack of the coordination between the agonist and antagonist involved in the eyeball movement for the full understanding of the different form of the nystagmus. गाइस आज हमने दो सिनेरियोज को कम्प्लीटली डिस्कस कर लिया है। इसके हवाले से कोई बात समझ नहीं आई तो आप ज़रूर हमसे पूछ लें। आज के लिए इतना ही, इजाज़त चाहूँगी। अल्लाह हाफिज़।